I'd like to bring in now physician at Stanford Children's Health, Dr. Alok Patel, for more on the pandemic. Dr. Patel, always great to see you, especially when talking about all the changes taking place, which seems to happen on a regular basis. The number that keeps changing, yes, unfortunately, 700,000 Americans now have lost their lives to COVID. What does this milestone, mean for us in the United States at this point?
Kira, this milestone is specifically heartbreaking and causing a lot of frustration, rightfully so, because I believe actually you and I had talked around the time when we hit 600,000 deaths, and that was about June 15th. So in the past 3.5 months, vaccines have been widely available to all Americans in all 50 states, and here we are with another 100,000 deaths. And it just tells us that there's two conversations happening right now in this country. One's about saving lives, and the other one is about this push for personal freedom and wanting, medical freedom and trying to do everything people can to get back to normalcy, when in reality, if we look at these statistics, about 40% of these recent deaths in the last 100,000 were people under the age of 65. We're seeing more young people get exposed and dying. And so, we have to really look at what's happening in the future now. Vaccines are already available. The Pfizer vaccine has full FDA approval. These are the things that we thought would turn the tide. So what are we going to do to prevent more deaths heading into winter, which inevitably will happen, but maybe at a slower rate, hopefully?
So today, as we mentioned, is the deadline for roughly 148,000 school employees in New York to get their shot or now face suspension. Then you've got California. It announced it'll require COVID vaccines for teachers and students. These vaccine mandates are getting a lot of mixed reaction from parents, doctors, the community. As a doctor, what's your take on this?
Well, my take, first of all, is that these mandates are nothing new, and I cannot stress that enough, because they are this COVID-19 mandate is the first mandate we've seen in more than a decade, and it's getting thrust into this political spotlight where people are fighting over it. Where, as a doctor, I will tell you that there are 10 mandates required of children. I should say that 10 required vaccines required of kids in the state of California to go into childcare and K through 12. And COVID-19 as a vaccine mandate is just following under the same guidelines, and we're doing everything we can to prevent the spread of this. And here's what happens with mandates: a mandate is not necessarily going to convince those who are hesitant to run out and get the shot. It's doing that to some, not only teachers, but also parents, people working for federal jobs. But Kira, what it's doing is causing people to have a conversation, which is a good thing. Parents I talk to, we're having conversations with their social circles, with their pediatricians, saying like, hey, okay, now I'm forced to get the shot. I was on the fence earlier. Talk to me about it. And that's actually working. And when we say there's a mixed response, what I would counter and say is, yes, there's a mixed response on media. But the vast majority of people are still going out and getting the shot in these groups, with over 90% of teachers and principals in New York State having gotten fully vaccinated. The minority who are against it just have a very loud megaphone.
So the booster shot now, let's talk about this. It still is causing a lot of confusion. Who's eligible, and when to get it. So help us clear things up. How should those who got the Pfizer vaccine know when or if they should get a booster? And then lay out Moderna and J&J for us.
Well, we're still waiting on data. And we're still on the full approval for, I should say, the emergency use authorization for Moderna and J&J, with J&J just announcing recently they're going to submit data as well. And so for the millions of people who got those two shots, we're still in a little bit of a holding pattern. But regarding Pfizer, we know that those who are at increased risk because of their job, increased exposure, those who are above the age of 65, or anyone with an underlying medical condition is eligible to get a booster. And you really have to think about this on an individual basis, because, Kira, those are broad categories. So I totally understand why people out there are taking a step back and saying, oh my gosh, am I eligible? Chat with your healthcare professional. And if you have any concerns that you may be in one of those three groups, chances are you're in one of those three groups, and you should run out and get a booster just to keep up your level of protection, but also to, just really ensure that you're not spreading it to anyone else, should you get symptomatic. And for people out there who aren't yet eligible for a booster, remember, this vaccine is very efficient at protecting you from hospitalization or death. When we're talking about a booster shot, we talk about breakthrough infections, we're talking about symptomatic COVID-19. We're not necessarily talking about deaths. And that last 100,000 deaths that we've seen since June, the CDC estimates that only about 3,000 were in vaccinated individuals. So booster or not, you still have great protection.
And I like carefully placed over your right shoulder there, your thick book on vaccines. We're glad to know you are constantly being read up. Dr. Alok Patel, physician at Stanford Children's Health. Always great to see you. Thanks, Alok.
Evidence-based always. Thank you.
Always.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.